The top 3 facts, I guess mainly for endometriosis, would be it's definitely a disease that I think is underdiagnosed. So if you are someone that is experiencing pain with intercourse, pain with cycles, it's definitely something that you want to think about. The second thing is that I do think there's a huge physical and emotional component when it comes to endometriosis. So I think offering empathy as well as knowledge on it is one of the big things. And then third is just having an understanding of the disease process, and that one treatment may work for you one day but may not work for you a month from now or a year from now. And so that it's definitely a process that if you are not planning on having a hysterectomy, then there's no true cure except for suppression or surgery. Top 3 facts about fibroids is just to know the symptoms of them. If you're having heavy bleeding, then I would definitely come in and get an evaluation. That if you're having bloating, distension, that's something you definitely want to take a look at. And to also know that with fibroids that you have multiple treatment options, and to take a look at all those. If you want to get pregnant, then a myomectomy or removing the fibroid is definitely the best option. However, if you are not, then hysterectomy or even ablation or things that are less invasive or less time-consuming and painful for the patient are options as well. So usually it's in your premenopausal patients. So the age range of both of these actually, so with endometriosis it's actually a little bit younger, but it can start as early as in your teens, and it goes usually up to the age of in your mid-40s is what we see it in. As far as fibroids, the age range for that is usually a little bit later that you start to get diagnosed with. I want to say as early in your mid-30s and up to, you know, around your 60s is the age range for that. So if a patient is diagnosed with endometriosis or fibroids, their options in their journey for fertility actually have improved significantly over the past couple of years, especially with minimally invasive surgery being an option. There's good surgical management out there for these patients, and then there's good infertility treatments out there. So while patients before just had to live with something like this, and there were only like 2 or 3 options for them, now you have a handful of options where you can undergo surgery and then try, and then if that doesn't work, then you can even go to an infertility specialist where you're doing in vitro and things like that, which was not the case previously. So egg freezing is something that I discuss with a lot of my patients, and usually my patients that are 35 and older. I don't necessarily discuss it with them based on having fibroids or endometriosis, but I usually discuss it based on just lifetimes and their situational. You know, are they in a relationship, things like that. Are kids something you want in the future? Egg freezing might be something or an option for them. Now, as far as patients with endometriosis and fibroids, usually, especially with fibroids, egg freezing is not the underlying issue. With endometriosis, it can be, because these patients, when they start to get their cycles again, they can get in a lot of pain, right? However, if you do egg freezing, then you're not trying for a year, you're doing a specific cycle, and so you're not putting yourself in a position where you're going to be in pain for a year trying to get pregnant. One can expect from our facility in dealing with these types of conditions, endometriosis, fibroids, is that we are very well and apt to treat and diagnose these disorders, as well as we are able to provide that quality one-on-one care where we can provide the empathy. We understand, you know, what it can do to a relationship, to a patient. This is just me talking personally. I've lived with it since I was 14. I've experienced missing school. I've experienced, being sent home from school because I was in so much pain. I've been on so many different birth controls. I've been on Lupron, and so I understand what you're going through. I understand what these patients are going through. I understand how it can affect the decisions you make in life, and so you kind of get that quality care or that compassionate care that you may not get from somebody else. So my personal word of advice is to know that you're not alone. Infertility is one of those, taboo things to talk about. I have so many friends that don't even talk to me about it, even me being a gynecologist. But I also know so many people that have gone through it. My sister, all my sister's kids are in vitro babies. And so it's just to know that you're not alone, and to know that in dealing with this process, to kind of not let it take over you, still live your life, live a healthy life, go exercise, do your stress reduction things, and it will happen. These things will happen for you. It's just, don't let it consume you. So a fun fact about myself, oh gosh, let's see, I play the violin. I used to be a Zumba instructor. Oh God, see, I'm not gonna say one. I have a Huskimo. It's the cutest little wolf dog ever. Yeah, I guess those are 3 little fun things about me. Someone can get in contact with me by either looking us up online. It's Elite OBGYN or Aventura OBGYN Associates. We are on social media, so I go by Couture GYN Doc is my social media account. And then also our website, which is eliteobgyn.com.